Hello, and thank you for joining us once again. I'm Sandy Potter, along with Masonicare President and CEO, JP Venoit, and Dr. Ronald Schwartz, our Senior Director for Continuum Health Services. We're checking in with you once again as we all work together to help prevent the spread of coronavirus. Dr. Schwartz, let's start with you. There's been some growing concern over the COVID variants that are being found and the idea that they may be more easily transmitted. Some health officials have even suggested that we might want to consider wearing two masks when we go out in a more public situation, such as a grocery store. We're curious to hear what your take is on this issue.
Sandy, once again, an excellent topic, and this is a somewhat more controversial topic as they're still gaining scientific evidence and so forth. What I try to do is, I look at different authorities and look at CDC, and actually I was watching the news, and I have a quote from Dr. Anthony Fauci, and he's the director of the National Institute of Allergies and Infectious Diseases. I think most people know him. He said this last week. This is just a quote. He said, if you have a physical covering with one layer, you put another layer on, it just makes common sense that it would likely be more effective. So what does that mean? What I guess he's trying to say is that, in certain situations, and it's not recommended globally, but in certain situations, double masking may have some benefits. If you, let's say, are taking care of a relative, someone in your house has active COVID-19 infection, it may make some difference. But I think the real point that I wanted to emphasize is that double masking shouldn't give you a false sense of security. What that means is you shouldn't give up everything we've been saying over and over again to, first of all, wear at least one mask, socially distance, wash your hands, avoiding travel. And I think now probably one of the most important things I can say is get your vaccines. So, the other thing is it doesn't matter how many masks you wear if you don't wear the mask properly. So if a mask is loose fitting and, you have gaps in your face and the virus can come and get spread and so forth, it's not really effective. And also some people, they don't like the feeling even of one mask, let alone two masks. And if you find that you're constantly pulling the mask down, below your nose, again, it isn't doing any good, and you might as well just, stick to one mask. But, again, in trying to further answer your question, I researched the CDC, and the CDC is the Center for Disease Control. And at this point, the CDC doesn't recommend double masking. It just generally says that people should wear masks with two or more layers of a washable fabric that cover the nose and mouth and fit snugly on the face. So that's kind of the general statement. And then there's about 6 recommendations for masks for the public that the CDC recommends. And I'm going to read them to you because my memory isn't as good as it used to be, and I can't memorize everything anymore. But so the first one is, and this is for the general public. We're not talking about healthcare workers or being in a nursing facility like we work in or hospitals. But the first is non-medical disposable masks, single use. We talked about the second one before, masks that fit snugly around the nose and chin, no large gaps around the sides of the face, masks made with breathable fabric such as cotton, masks made with tightly woven fabric, and importantly, masks with 2 or 3 layers, and masks, another possibility is masks with inner filter pockets. So, by now, I try to come up with an inspirational message, and my inspirational message this week actually comes from Socrates. And Socrates said, the secret of change is to focus all of your energy not on fighting the old, but on building the new. And I guess that's what we've been doing for a while now, and trying to change the way we think and the way we look at things and the way we do things to the new norm of still being cautious and socially distancing and wearing our masks, washing our hands, avoiding large crowds and groups, and just limiting travel, and certainly probably again now the most important thing is getting vaccinated. And I think if we continue to follow these recommendations, we'll continue to improve our quality of life together, and we'll get through this. So again, I want to thank all of you for everything you're doing, and I wish you health and peace. Thank you.
Thank you so much, Dr. Schwartz. As always, we appreciate your insight. And JP, the three of us were talking off camera about being at a very pivotal point in this pandemic when the message about really staying the course is still so important.
Sandy, it's very interesting when we talk about really staying the course, because that's truly what's going to get us to that normalcy while we're in the process of doing our vaccinations. So far, as of yesterday, the state of Connecticut has given out about 465,000 vaccines. The majority of those have been the first dose. So there's a lot that needs to be done over the course of a few months to really get us to where we need to be. With that being said, we still have to do what Dr. Schwartz talked about: wearing a mask, socially distancing, avoiding large crowds. And if you think about it, this weekend is one of those times where we really need to be conscious of our decisions that we're making. Super Bowl is this Sunday, and I know people want to get together, watch the football game, and root for their team that they want to see win, but we don't want that to come at a cost of people getting sick, spreading it. We are, as it looks right now, we're seeing the positivity rate drop, and that's good news. And that's because people have done a very good job at heeding the warnings of the professionals. But we still need to continue to do that. As this vaccine continues to get administered, we need to make sure we are doing our best and being vigilant in staying safe by wearing a mask, socially distancing, avoiding the large crowds. Those are really important things that are going to allow us the ability to get to the normalcy that we all are so desiring, and our residents are looking forward to, our staff are looking forward to. And I would be remiss if I don't say this, but our staff have just done a truly amazing job. I can't tell you how proud I am of everything that they've been doing during this time. We actually are at 333 days since the start of our task force. We are almost in a year of this battle, and our staff have done just an amazing job. And our residents and those that we serve, thank you for allowing us the ability to be there with you and keep you safe. It's been truly a journey for all of us, and we just need to continue that last push. For a football term, we're in the red zone right now. We need to push hard to get into that, get that touchdown. And that touchdown is beating the coronavirus and getting us to normalcy. We are this close to doing it.
Yes, we're going to stick to the game plan.
Yes, you got it.
That's the message of the day. Well, thank you both so much for sharing your time with us and all of this important information, as always. And thank you for joining us at home. Until we see you next time, we hope you'll stay safe and stay well.